Alzheimer's, Alternative Therapies, Part 2. About a year ago I did Part 1. Go check it out. Good show. I did a good job. This one I want to talk about an update. So a patient of mine comes in and his wife has been diagnosed with Alzheimer's. They are the only people that I personally know that have done the Bredesen protocol. Dr. Dale Bredesen, his book, The End of Alzheimer's, he's a medical physician and he has a whole protocol that you can follow to actually make improvements in after an Alzheimer's diagnosis. And that's what many people, not that I personally know, but many people that have done this protocol. Dr. Dale Bredesen has been on Dr. David Perlmutter's show, and they have interviewed each other, and a couple of other references are going to all tie together. So here's the update. This man's wife was diagnosed 5 years ago with Alzheimer's dementia. They did the Bredesen protocol and actually started some improvements. Now he updated me today and he said, she is deteriorating, but he said, I am completely convinced she would be much, much worse right now if we weren't doing that protocol for several years now. So that's the update on the one couple that has done this program, Dr. Dale Bredesen's protocol. I'll get into that in just a moment. And I have mentioned the book and the protocol and the other references in just a moment to many dozens of people face-to-face and patients and families. And of course, hundreds if not thousands of people on cable and YouTube. And I only know this one couple that have actually done it. It's not easy, but I think extremely worth it, particularly if it makes improvements, right? So let's get into our list of things that we can do for better brain health, or if you've been diagnosed with dementia, to make some changes. Again, disclaimer first. Do not do anything on this protocol or any other recommendations that I'm making, dietary changes, exercise changes, supplement changes, at all, unless you first talk with your medical physician and make sure that it's okay there first. Do not change any medications without talking to the doctor and so forth, okay? So you've been warned. Don't change anything until you talk with your doctor. Okay, so here is the list. First is exercise. Next is nutrition. Next is sleep. Number 4, stress. Number 5, supplements, including coconut oil. More on that in a moment. Number 6, water. Number 7, chiropractic care. And number 8, low-level laser therapy. That's our list. These are the things that have been shown to help the brain in some people. No promises made, but this is where you can look. I actually changed it up and I put exercise first now. Dr. Peter Attia, and I've mentioned him on my show several times, and he's had many guests on here, kind of saying that it's, when you look at exercise and nutrition, which is better? You look at Jack LaLanne from 60, 70 years ago saying this kind of stuff. Jack LaLanne said, exercise is king, nutrition is queen, together you have a kingdom. It's kind of like leaning a little bit more towards, if you want a body that works and you want a brain that works, resistance exercise is the way to go, okay? Resistance exercise. So Dr. Peter Attia and others have said, the general exercise recommendations are just foolish. It's just not enough. If you're walking, it's a good start. Certainly, if you're able to walk and you are walking for exercise, good, keep going, but that's not enough. We need resistance exercise. Get assistance, get help. Understand its importance, and most people with even physical disabilities and so forth, we can do a variety of things. I mean, the personal trainer skills and talents and physical therapy skills and talents and the way you can maneuver around things to get people to do resistance exercise is awesome now. It's almost endless, okay? Nutrition, it's out there. I think people know what to do. Eat real food. Eat the cleanest diet that you can still enjoy and so forth. Get away from processed foods, and we've talked about that many, many times on this show. Getting better sleep, we've done sleep shows on this as well. Rest has been just shown to allow the brain to basically clear itself and detoxify and cleanse and so forth. Reducing stress. The more you crank up your stress chemicals, the more you're going to break down those neural pathways with inflammatory chemicals and so forth, right? The more you get into reducing stress with all kinds of different strategies, the better your brain is going to be. Supplements, there are all kinds of brain supplements. I've talked about omega-3 fish oil. I've talked about antioxidants, B complex, magnesium, vitamin D. There's a whole list of things that we can take. Dr. Dale Bredesen has a tremendous amount of supplements that he recommends. But then I mentioned coconut oil, coconut ketones. Dr. Mary Newport's book, What If There Was a Cure? And she talks about taking her husband out of deep dementia with coconut oil, coconut ketones, and so forth. Okay, so look at that. Water intake, most people's water intake is not good, particularly with the elderly, because they tend to have to go to urinate more frequently. At night, they don't want to get up out of bed, so they're afraid of drinking any water at all, so we have to address that. Water Rules is my video and show that I've done in the past. We front load the day. You start the day immediately with water. Drink all of your water between breakfast and lunch. Shut it down as best you can after dinner, unless there are medical reasons that you need more water or you have to take some pills or supplements or something like that. I added chiropractic on here. Now, there are great scientific studies with chiropractic and dementia as an example. Not exactly that I'm aware of, but once again, we do know that there is scientific evidence that an increase in blood flow occurs after one chiropractic adjustment. Glucose uptake is something that has been shown to increase with chiropractic. We have seen decreases in blood pressure, okay? Again, all of these are tied together. They're tied together because one of the gifts that chiropractic offers the human body is when you stimulate those powerful nerve endings in and around the tissues of the spine, they will quiet down the sympathetic nervous system that turns things on and allows the tone of the parasympathetic nervous system come up. Decrease in the gas, increase in the brake. That's why blood pressure goes down in some studies after chiropractic care. Blood flow to the brain improves, decreases in pain and in inflammation, right? So that's why I put that on there as well. And lastly, low-level laser therapy. So before I came in here, I did a search on PubMed, and I put in Alzheimer's and low-level laser therapy, and 3 interesting hits came up. Okay. Now, there are 22 FDA clearances for low-level laser on humans in the United States. 19 of the 22 were written by the company called Urconia.com. Those are the lasers that I've been using for 18 years. You can go to their website and they have the research. Now, here's a couple things that I picked up. I'm just going to read the titles. And if you're not into the science stuff, just ignore me for the next minute or so. And then I'm going to get into some references and we'll be finished. So here's the ones that I came up with today. I haven't read the research articles yet. But low-level laser therapy rescues dendrite, part of the nerve cell, dendrite atrophy via upregulating BDNF expression. Implications for Alzheimer's disease. Wow! Journal of Neuroscience in 2013. Okay. Next, low-level laser therapy ameliorates disease progression in a mouse model of Alzheimer's disease. Interesting. I'll be looking into that. Journal of Molecular Neuroscience 2015. Next title, low-level laser therapy to the bone marrow, meaning they're lasering the bone marrow, okay, ameliorates neurodegenerative disease progression in a mouse model of Alzheimer's disease, a mini review. Photomedicine and Laser Surgery is the journal 2016. So remember that I've done shows in the past on low-level laser therapy. I talked about the physiology. Urconia talks about the physiology. The science is in there about the effects on cell, adding light photons to cells. I've done a show on how I've had 4 good cases of concussion getting better with the addition of low-level therapy to the brain. There are now new devices that are talking about photobiomodulation, these skull caps and things that I just learned about one of them today, putting that on there to add photobiomodulation laser, low-level laser therapy, to the brain and seeing what can change there with that nerve chemistry and so forth in dementia and other conditions. So there's some applications here, and that's our list of things that we can try. If this interests you at all, here's some references. I mentioned The End of Alzheimer's by Dr. Dale Bredesen. You can look at that book, and he's information on the web, easy to find. Another book by Dr. David Perlmutter called Brain Maker. He's got another one called Brain Wash. Brain he wrote also. So look at Brain Maker. Great website, interviews. By the way, Dr. Perlmutter interviews Dr. Bredesen on his show. He interviews Dr. Mary Newport coming up in a moment. This book, you just don't want to miss this book. The Hacking of the American Mind by Dr. Robert Lustig. He wrote the book Fat Chance. Then he wrote the book The Hacking of the American Mind. It's off the charts good. You want to check that out, Dr. Robert Lustig. And the last reference for this particular piece here, Alzheimer's Disease, What If There Was a Cure by Dr. Mary Newport. I'm Dr. Scott Fuller. Thank you.